Our topic today is a femoral nerve. A 40-year-old woman is brought to emergency department following a low-speed vehicle accident. The patient was the front passenger seat. During the accident, she hit her head against the wheelchair and hurt her right leg. She appeared alert and oriented. The Glasgow Coma score is 15/15. Bilateral pupils are equal and reactive to the light. There is a bruise over the right forehead, but no tenderness is present on the palpation or the cranial bone. An examination of the right leg shows a hematoma over the thigh. The right knee extension and patellar reflex are markedly reduced compared to those on the left. There is decreasing sensation to both sharp and dull stimulants over the anterior side of the right thigh and the medial side of the lower leg. All other dermatomes are intact. This patient most likely has injury in which of the following? Is it a common peroneal nerve? Is typically caused by fracture or compression on the proximal fibula and association with foot drop. But in this patient has sensory and motor deficit considered with the femoral nerve, and this is affecting the anterior compartment of the thigh. As in this picture, the patient has sensory and motor deficit considering with the femoral nerve injury. The femoral nerve innervated the muscles of the anterior compartment of the thigh like quadriceps, femoris, sartorius, and pectinus. This is responsible for knee extension and hip flexion. It also provides sensory to the anterior thigh via the anterior cutaneous branch of the femoral nerve and medial leg via the saphenous branch. Patients with the femoral nerve injury also having decreased patellar reflex as this patient, as reflex involvement of the quadriceps muscles. This femoral nerve is vulnerable for injury from pelvic fracture, hip dislocation, or even hematoma. It can also suffering iatrogenic injury during prolonged maintenance of the dorsal lithotomy position, as in hip, pelvic surgery, or childbirth. Or vascular procedure involve the femoral nerve or via anesthesia for the anterior thigh, and the knee can be providing a femoral nerve block with the injection of anesthetic in the inguinal crest below the inguinal ligament at the lateral border of the femoral artery. When we go back to the chart, an ilioinguinal nerve is providing sensory innervation in the upper medial thigh or genital region, and an obturator nerve innervated the medial compartment of the thigh. As conclusion, the femoral nerve is responsible for knee extension and hip flexion and providing sensation to the anterior thigh and middle leg. It is vulnerable to injury from pelvic fracture, hip dislocation, or iliacus hematoma, and can suffer from iatrogenic injury during prolonged maintenance of the dorsal lithotomy position or vascular procedure involve femoral artery or vein. Thank you for listening.